we are looking at how anesthetic has affected us over time. Anesthetic improved uncivilized and violent ways in the past, like overdosing on alcohol, being punched on a jar, or taking drugs. This matters was very dangerous and could be fatal. Anesthetics has had an enormous impact on many people's life. It allows the doctors to safely mend another person's body while knocking them out safely. But how did this invention come about? It started with young Boston dentist William T.G. Morton and older doctor John Colin Warren. These two men changed surgery to be better on October 16, 1846, when they performed their first successful surgery procedure with anesthetic. Nitrous oxide, or what we call laughing gas, is what they used to use and could be dangerous of lack of oxygen. Many other doctors improved on this invention. Joseph of Dore was a patient and is the first person that used the endotracheal tube. This tube allows gas to go up your nose and mouth and fill it with anesthetic.
Arthur Grodwell and Ralph M. Waters added cuffs to the tube in 1932, which allows positive pressure ventilation. This means the gas flows into the lungs until the ventilator's breath is terminated. Dr. John Lundy used sodium thiopental and made it gain popularity between years 1894 and 1973. Nowadays, we use three types of anesthetics: local, regional, and general anesthetics. This helped reduce the fatality rate from 640 deaths in 1 million surgeries to 1 death in 4 million surgeries. Firstly, there are a difference between each anesthetics. For instance, local anesthesia is only for a small-scale trivial areas, but regional anesthetics occurs on a specific body parts. These two anesthetics create a positively charged electric barricade which repels the positively charged particles. However, regional anesthetics include neck blocks, which affects your body from the waist above, while spinal blocks affects your body from the waist down. Amazingly, this type of surgery could be done when patients are wide awake. Next, general anesthetics impacts the entire body's nervous system. This type of anesthesia differs from regional anesthesia because the negatively charged particles get stuck in the brain's receptors.
After the particles accumulate, a blockage of negatively charged particles will then stop transmission signals moving in or out of the brain into the body, which will affect the frontal lobe, primary motor cortex, and limbic system, or consciousness, movement, and memory. The medicines that are used for general anesthetics include propofol, which makes you sleep, diethyl ether, which is a pain relief, and baclofen, which is a muscle relaxant. All these medicines are important during procedures. Firstly, sleeping medicine is important because it makes people sleep, so the patient does not wake up while his organs are being taken out. Pain relief medicine is necessary as it reduces stress on the body, which can lead to an increased heart rate and high blood pressure. If it becomes severe, it could even trigger heart attacks, causing death. Lastly, muscle relaxant medicine. We need to have complete paralyzation to effectively start a surgery. In conclusion, anesthesia helped improve the life of patients and surgeons because it helped patients relax mentally and sociologically, and the surgeon will have peace in mind while performing the surgery. Without these anesthetics, patients have to endure the pain, which can lead to other problems, such as blood loss, poor wound healing speeds, higher infection rates, and even heart attacks to strokes.